this is my first experience with Dr. Kleban, and we're doing 2 surgeries. This is phase 1 today. What made me really comfortable with Dr. Kleban is I didn't have to ask her any questions. I had a list of questions and she hit all of them before I could even ask them.
Again.
Breakfast of champions.
Is that what you're gonna eat all day? Did you know we're together later?
I can't wait. Whose are these?
I mean, I don't know.
He wants his own camera time.
Yeah. he can share. We can share. It's fine. Ooh, look at that. That's exciting. Yeah. Everything went great in surgery.
Looks good.
Yeah.
So we're going to talk about big booty Judy versus skinny booty Judy. We love all Judys, but sometimes we like making the big booty Judys.
Can you show us that again?
Like a dump truck. You know, that's the thing, the dump truck. The athletic.
Right, like athletic, like just that little oomph.
Mm-hmm.
Yeah.
So it's just
I wish I had
like,
that. I wish I had
like
that little oomph. You know, Jason asked me last night, he said, is there anything else that you would have done, like surgically? And I was like, well, I would do a little lipo here. Maybe I'd put him, you know, like fat transfer.
Mm-hmm.
He's like, okay, I could see that. I was like, rude. I'm a skinny booty Judy, I guess. He grows on you like a fungus, you know?
I told you, it's like beer. The first time you have it, the first time you had beer as a kid, you're like, whoa. And then after a while, you're like, hey, this is actually pretty good. That is Dr. Barada.
Why are you having beer as a kid?
So I'm preparing for the case later today. I have one case this morning, and then I'm doing a big body contouring case after massive weight loss for this lovely 31-year-old patient whom you'll see later today.
Okay, so this is my first experience with Dr. Kleban, and we're doing 2 surgeries. This is phase 1 today. Phase 2 will be a back lift at the bra line, and then we'll do my thighs, so I'll do an inner vertical thigh lift next, whenever that is. But what made me really comfortable with Dr. Kleban is I didn't have to ask her any questions. I had a list of questions and she hit all of them before I could even ask them. And then, of course, being the person that I am, I came back with more questions, had another consultation, and one of the things that really stuck out with me was I asked her to shop with me on Amazon for post-op care. And she was like, here, these are all the things that you're going to need. If you really want this, you can use these products, but you can also use these other products as well. And we literally just shopped on Amazon for everything. So it's not really a doctor-patient, but really just a friend, mentor, continued health advocate. So I think that's what's really awesome about her.
This patient has lost a lot of weight, but when you lose weight, sometimes there's excess skin. That's where I come in. I'm basically a glorified tailor. I'm gonna nip and tuck, remove that excess skin to give her a better shape overall. She's put in the work. Now we're gonna reveal all that work by removing some excess skin. And super rewarding surgeries. These patients have worked so hard to get here, and we're kind of right at the finish line for them.
So we are the anesthesia provider. We are an advanced practice nursing position. We go to school. We have a master's degree in anesthesia. We can practice independently. So we are here to make the patient happy, comfortable, and stay asleep under general anesthesia. And here I'm in charge of everyone. No, as circulators, we have to make sure that everything is going okay. We have to open the equipment for them sterilely if needed. Make sure the patient is safely on the table and prepped. We chart, we count.
And you're a DJ.
And I'm a DJ.
I, like Olson, am a nurse circulator. We get things that they need. If they need anything that they forgot maybe to set up, we count, we look after the patient, we do the pre-op, sometimes the post-op. That's our #1 priority. We advocate for the patient. We are with them in the pre-op. We hear what they want, their desires, what they need.
I'm a surgical tech. I like
a vet here as well. And our job is to maintain sterile field, make sure our surgeon has the appropriate instrumentation to complete the procedure, make sure everyone stays on task, keep track of our instruments, and keep the patient safe.
All right, so finally finished our last case of the day. Was a big total transformation after this patient lost 125 pounds, removed a total of 22.5 pounds off her body from her arms, abdomen, and lower back. She's looking great. She's doing great. I'm exhausted, but that's kind of how this all goes. And I'll check on her tomorrow, see how she's doing. She's getting the rest of her dressings on right now and then going to come out to the recovery bay, stay overnight with us for monitoring. And yeah, she's got a journey ahead of her, but the big part of it's done now.